So today I was talking about primary hyperoxaluria type 2, which is considered to be fairly uncommon, but we have the largest number of patients in one place in the United Kingdom. We have 60 patients in the United Kingdom, and I think it's because I have had very wonderful help from Jill Ramsby in London to make the diagnosis. And so I think if we can make the diagnosis and look for the diagnosis, I think this disease is not as rare as we first thought, and I'm absolutely sure that there are more patients all over the world with this condition. What's changed about the presentation is that when I was first talking about it in 2000, we were thinking it wasn't such a bad disease to have and that you didn't go into kidney failure, but now we know that you do, and that at least 20% of the patients have kidney failure, and that in fact it's not as benign a condition as we thought. So it's really important to make the diagnosis, and really important that the physicians are aware that the kidneys can change and that dialysis may be necessary. So the way the system works in the United Kingdom, there's 13 children's dialysis units, and they are located all over the country, but the Birmingham Children's Hospital is the only one where the combined liver and kidney transplants take place. So all the patients who would have primary hyperoxaluria type 1, for example, who are going to be treated with a combined liver and kidney transplant, they come to Birmingham for treatment in our centre. And so we now have a very big experience of these patients and their outcomes, and I would say that the experience is so much better than it used to be 15, 20 years ago, and we have much greater survival and much greater improvement. But I think still for the children who are under 1 year of age, who have to have a liver and kidney transplant combined, the outcomes are still very hard and difficult, and I think the longer they have to wait to get a transplant is incredibly important in their success and outcome. So if they can get a transplant early and they have a very short time on dialysis, then I would say their future is so much better than if they have to wait for a long time. So I think one of the big jobs that we have to do is try to promote the importance of early transplantation, and trying to also promote families donating parts of their liver and a kidney, so that these children can progress on much more quickly and have a better outcome. I also think that the new research that is coming forward from different companies to maybe take away the need for the liver transplantation is going to be really important, and these new trials will be really helpful for particularly those families.